Now in this video we are going to start with puberty. So in the puberty, the general points which you need to see, the age at which the male and female start having secondary sexual characters. So the male and female are they started developing the secondary sexual characters, that is nothing but called as puberty. Okay, so to form the secondary sexual characters there should be activation of HPO axis, that is nothing but a hypothalamo pituitary axis. If it gets activated, then it brings a hormonal changes. So to get this activated we need a neurotransmitter which would get changes in them. So because of changes in neurotransmitter, the HPO axis will get activated and it will lead to formation of different types of hormones. So these hormones are like the neurotransmitters which are increase in puberty and which are decrease in puberty. That is important to remember. So the neurotransmitters which increase in puberty, you can remember the mnemonic LPG. That is the leptin, P for kisspeptin, and G for glutamate. So these are the neurotransmitters which are increased in puberty. So as they are increased, they are bringing some kind of changes. And the neurotransmitters which are decreased in puberty are the that is which is putting the HPO axis dormant, especially the GABA, and the another one which is decreasing in neuropeptide Y. So neuropeptide Y and GABA are decreasing in puberty. So now coming to arcuate nucleus. So you know the arcuate nucleus which is present in our brain which get activated so that the gonadotropin releasing hormone is released in a pulsatile manner. As it is released in a pulsatile manner, initially the GnRH is released only at the night time. Okay, but because of pulsatile release of LH at night, then later the cycle becomes more stable. Then the cycle is turning into stabilized. So the first hormone which is formed by GnRH is luteinizing hormone. Okay, so later it will get stabilized and it start forming both a luteinizing hormone and also FSH hormone, and that release both at day and night. So now this will go and act upon the ovary of a female. So it will release a estrogen because of acting on this, and the estrogen is responsible for development of the secondary sexual characteristics. Now coming to GABA, GABA is a neurotransmitter that keeps the HPO axis dormant, okay, before puberty. Next coming to the kisspeptin, the kisspeptide, right, which is a neurotransmitter which is responsible for pulsatile release of gonadotropin releasing hormone, and that is leading to puberty. Okay, so GnRH is required for puberty. So coming to leptin. Leptin is a neurotransmitter which acts as a somatic stimulus. For the onset of puberty, it is giving a permissive role. So it is giving permission of for the neurotransmitters, like it is giving a somatic stimulus. So it is leading to somatic stimulus and onset of puberty. Now coming to puberty in male versus female. So let us start first with the female. In the female, the puberty is in 10.5 years, or you can say 10.5 years. But in the male, the puberty is 11.5 years, or you can say 11.5 years. Okay. So in the female, the first sign which you see in a puberty is a growth spurt. So what is a growth spurt? It is an initiation of skeletal growth. So in a female, the skeletal system start growing. That is the first sign of puberty. And the first visible sign, this you can't see, right, whether skeleton is growing or not. But the visible sign is telarchy. Telarchy means the breast is budding, and it is a more specific sign in a female. And the another specific sign is pubarch, that is the appearance of pubic hair. Okay, pubarch is appearance of pubic hair and axillary hair. Next, another sign is peak height velocity, that is the female has achieved the maximum height. And next coming to menarche. Menarche is onset of menstruation, that is the menstruation started 12.5 years after puberty. So puberty is in 11.5 years in a female. So 2 years gap, the female have a chance to undergo menarche. That is the onset of menstruation. It is in 12.5 years, and the chromosome which is leading to menstruation is chromosome 6 and 9. Now coming to the male. In the male, the puberty, as we discussed, it's 11.5 years, and the first sign which you can say the female has come to puberty is testicular enlargement, and the next sign which you see is penile enlargement And following it, you have pubarc and you have peak height velocity. So pubarc, after that the male has come into the maximum height. Now coming to the most important secondary sexual characteristics in female is the breast development, and that is mainly because of estrogen hormone which is leading to breast development in female. Remember one thing, that the pubic hair or the axillary hair in the female are dependent on androgens, but not on estrogens in female. Okay, so androgen in female is leading to formation of pubic or axillary hair. Now coming to the Tanner staging. Tanner staging is for breast and pubic hair development. It is done for this. In a female, it is divided into 5 stages, that is first and second stage and fourth and fifth stage. The first and second stage indicate that there is initial stage or less development of both breast and hair, whereas 4 and 5 stage indicate the fully development of breast and also pubic hair. Now coming to precocious puberty and delayed puberty. So what is this precocious and early, delayed puberty? Precocious puberty means early onset. In some females, you see they are like having a puberty early age, and also they'll have the menstruation period early. Okay, so that is precocious puberty. That is, if a female is coming into puberty less than 8 years, normally she should come in the puberty for 10.5 years, but 8 years. So 9, 10, 2, it's 2.5 difference. Okay, so here the breast starts budding in the 8 years itself. Okay, and in the male, if you see less than 9 years of age, there is testicular enlargement. You know that in the male there should be puberty 11.5 years, but here 9 years means 10, 11, again 2.5 difference. So in the 2.5 years of difference, there is precocious puberty both in male and also in the female. Okay, so what is the most common cause of this precocious puberty? That is, it's idiopathic. We don't know what the cause. But in the girls, it is more common. This precocious puberty is more common. So the female have more chance to be puberty in a lesser age when compared with male. So why this happening in girls only? Because of excess of estrogen in girls, and the drug of choice which you can give here is gonadotropin releasing hormone continuously. Because if you give in a pulsatile manner, it will lead to again more increase in estrogen. But if you give it in a continuous way, it will lead to decrease in estrogen, so that this problem can be decreased in female especially. Now coming to delayed puberty. Delayed puberty means the female or the male, they're like getting the puberty in a late age. So in the female, the delayed puberty is like the secondary sexual characters are still not appeared by 13 years of age. Usually they should appear by 10.5 years, but it is delayed to 13, means 10 means 11, 12, 13. So 3.5 years gap, increase 3.5 years. Okay, so in the males, the testicular enlargement has not occurred in 14 years, means normally in males it should be like about 11 and a half, right? So 11 means 12, 13, 14, right? 2.5 years difference. Here also 2.5 years difference. So because of that, there is leading to delayed puberty. So the most common cause is constitutional delay. What is the most common cause? Constitutional delay, and this is more common in male. So male will have delayed puberty and female will have mostly precocious puberty. Okay, in females, the delayed puberty is generally pathological, and the drug of choice is here gonadotropin releasing hormone, but here in a pulsatile way. So before you have given gonadotropin in a continuous way for precocious puberty, but for delayed puberty we need to give it in a GnRH in a pulsatile way. So one more thing which you need to say is what is precocious menstruation. If the female got menstruation less than 10 years, that is a precocious menstruation. Okay, so finally coming to precocious puberty, let us discuss it. Actually, the precocious puberty is divided into two types. One is central and one is peripheral. As you can see here, I have written them. One is central, one is peripheral. So first let us see that what is in central and what is in peripheral. So the central, or it is also called as the true precocious puberty, here actually there is premature activation of hypothalamic axis. You can see premature activation. So because of this, there is more LH, more FSH, more estrogen, and this is a diagnostic point which you need to see. So due to increase in estrogen, the puberty is always isosexual. So causes 90% again idiopathic, but 10% is because of brain tumor. So here you can see I wrote it here. The 90% is idiopathic, but 10% there may be a brain tumor. So always don't neglect as it is idiopathic. You should always rule out brain tumor. So this female, the female with central precocious puberty, we should recommend the MRI scan for this patients. Okay, and the treatment is of course a gonadotropin releasing hormone in a continuous way. And one more thing you can see there is a hematoma of tuber cinerum in the brain tumor which we are saying, which is present in central precocious puberty, that is hematoma of tuber cinerum. Now coming to peripheral. The problem is due to exogenous projection of estrogen, that is isolated increase estrogen and increase in androgen. So here actually the HPO axis is not stimulated, but there is more production of estrogen and androgen and decrease of LH and FSH. So this estrogen, it will give a negative feedback to FSH, and androgen, negative feedback to FSH. So this peripheral, in this peripheral, the problem is negative feedback on both LH and FS. So decrease LH and FS, and it can lead to increase estrogen, increase androgen. So because of increase estrogen, increase isosexual, increase androgen, heterosexual. What is heterosexual? That is in a female you will see the male like characteristics. Okay, so causes because of increase in estrogen. It may be due to granulosa cell tumor or hypothyroidism. You can see granulosa cell tumor, or because of hypothyroidism, like especially alpha subunit, it is similar to LH and FSH. So next coming to McCune-Albright syndrome. Because of McCune-Albright syndrome, actually because in hypothalamus, as there is decrease in the in LH and FSH, there is increased TSH, so there is increased estrogen and hypothyroidism. And next coming to increase androgen. Androgen is increased especially in serotolyladic cell tumor, that is androgen secreting tumor of ovary, and also in congenital adrenal hyperplasia there is increase in androgen. You can see serotolyladic cell tumor and congenital adrenal hyperplasia. So now let us discuss something about McCune-Albright syndrome. In McCune-Albright syndrome, you will see the cave light spots, and there is also polystotic fibrous dysplasia, and also there is precocious puberty. So this is the thing which we need to see in puberty. So by this we completed puberty. Next we'll start with the menstrual cycle.